So hello, everybody. Happy Friday. My name is Kim, and I am from We Speak Student / More Care, and we are here today to talk to you all about your More Care insurance coverage through More Care and We Speak Student. This is for international students at George Brown College. So I just want to make sure everybody is aware that this is going over the international student insurance. If you are a domestic student, or an ESL student, please note that your coverage does differ from, some of the things we're talking about today. So if you do have additional questions for ESL based or domestic based coverages, we always have our contact center available to you. But this is specifically focusing on international students today. All right, I think we're going to get right into it. As I said, my name is Kim, and I am here to help facilitate the webinar, but my wonderful colleague Elizabeth is here as well, and she's going to go through all of the information for you on the website. Before I pass it off to Elizabeth, I just want to say one thing, and that is, I know you're about to get a lot of information shared with you, but I want you to know that we do not expect you to memorize everything that we're telling you today. We are going through the website for a reason. This way you can, work through the website yourself when we do get off. And we will be holding a question and answer period at the end. I do ask that you hold all of your questions until Elizabeth is done with her presentation, because I would say 9 times out of 10, your question will be answered in the presentation. So we will be taking questions in the chat box at the end of the presentation. But again, please, please, please hold your questions until the end. All right, perfect. Well, Elizabeth, you can take it away. I just made you host, so you should be good to go.
Thank you. All right, well, hello, everyone. Again, my name is Elizabeth, and I am with We Speak Student and More Care. So I'm going to be sharing my screen and going through the website. I'll be showing you how to navigate through the website, what's included in your plan, and pretty much just how to make the best of your health plan while you're studying at George Brown. So to start it off, this is the homepage. You'll get here by going to morecare.ca, as you can see in the search bar. From here, you'll be able to pick from the drop-down menu. So you all will be searching George Brown International. When you click that, this is your school's homepage. So you'll see that there's lots of different tabs, which I will cover. But to start off, I'm going to go through your coverage and the different maximums. So to get there, you'll notice that there's an orange box here that says international students, and you'll want to make sure that you click that one. It will direct you to this page where you're going to see lots of information. But don't stress, you don't have to memorize it. You can, just go to the website and view it at any time. So this will show you all of your coverage. You'll notice that there's 4 different plans. Please just note that you're automatically enrolled in the balanced plan. There's 3 different ones, so if you that are different than the balanced plan. So if you think that having an enhanced drug plan because you have lots of prescriptions, or that you need to see the dentist more often, it may be better for you to opt into one of the other plans. So just take a look through those, and you'll be able to change that. For sake of time today, I'm just going to go through the balanced plan. So to start off, we're going to go through the international OHIP alternative. If we were all together today, we'd be asking lots of questions like, does anyone know what OHIP stands for? Some of you may raise your hand and say you do know, some of you may not. So, since we're all virtually here today, I'll just tell you it stands for the Ontario Health Insurance Plan. And OHIP is all Ontario residents' primary healthcare. Ontario residents will use that if they go to the doctor or hospital. So George Brown and More Care have created a great alternative for all international students, where you pretty much have the exact same coverage as Ontario residents. So to start off, you'll see that there is a $1 million lifetime benefit maximum. Again, this is here for you if you are injured or you need surgery or visit a doctor. And there's different maximums within the $1 million lifetime benefit maximum, which include a $25,000 maximum for maternity expenses, $25,000 for psychiatric hospitalization, $10,000 lifetime benefit for self-inflicted injuries, $25,000 for oncology treatment, which is the study of cancer, You have $10,000 for repatriation and $10,000 for return home. I just want to make sure that everyone's on the same page with what return home means. Unfortunately, this isn't here if you're missing your dog or your parents and you want to go visit them. This is here for you in the event that you become severely ill and need to return home back to your home country to seek medical treatment. So that is your OHIP coverage. And if you continue scrolling down, you will see the prescription drugs. You have a $5,000 maximum, which includes 90% coverage on oral contraceptives and a $178 max for the NuvaRing. There's 8% coverage for all eligible medication with an $8 dispensing fee cap. Most of your prescription drugs and medicines are covered, including allergy serums, insulin injectables, and Gardasil vaccines. Please just note that if you are needing any insulin supplies, that you do use this pseudo DIN that you see here. This will just help reduce the risk of any denied or rejected claims. Scrolling down, you'll see your dental coverage. You have a $750 maximum, which includes 80% coverage on basic and preventative services. Basic and preventative services includes, examinations, consultations, cleaning, scaling, polishing, things like that. You also have 75% off minor restorative services, 75% coverage on extractions and oral surgery. You have 50% off endodontics and 15% off major restorative, services. I just want to note throughout the dental coverage, you'll see there's different things like 100% off network dentist or 90% off at the network dentist. We do offer a network dentist where if you use one of the dentists on that map, you can receive some extra additional coverage. I will show you shortly that map and where to find that, but just note that you are able to receive some more coverage if need be. We also like to recommend that if you are going to see the dentist, you give them your MoreCare insurance and then ask them for a quote where they'll be able to tell you how much is covered and how much you may be having to pay out of pocket. So you're not kind of shocked with an expensive dental bill. Continuing down, you'll see your extended health coverage. You have 80% coverage unless otherwise noted. So you will have 80% up to $25 per treatment, up to $300 per policy year. I also just wanted to make sure that everyone knows that the policy year is from September 1, 2021 to August 31st, 2022. So you have coverage to see chiropractors, naturopaths, podiatrists, chiropodists, osteopaths, physiotherapists, speech therapists, and massage therapists. Please just note that if you are seeing a massage therapist, you will need to go to a physician, a doctor, where they can give you a referral or recommend you to see one, and you will need to do this before you go to see the massage therapist. Continuing down, you have 80% up to $1,000 for services of a clinical psychologist, psychotherapist, which includes RSW and MSW social workers. There's also lots of other things that are included within your extended health. You can come to the website and take a look. There's lots of different things that are also included. Next up, we have vision. Vision, you have 100% coverage unless otherwise noted. So you have a $65 maximum for one eye exam, for an eye exam, and it's every 24 months. So, your extended health and dental and prescription drug coverage is per policy year, which again is September 1st, 2021 until August 31st, 2022. But for anything vision related, you will only be able to get it every 24 months. So if you were to go see an eye doctor today, January 7th, 2022, you won't be able to go see another eye doctor until January 7th, 2024. You have $100 for prescribed lenses and frames, as well as $100 should you be prescribed contact lenses in the event that you have any severe vision issues. Continuing down, there are accident benefits. Accident benefits aren't the most fun thing to talk about, but it is very important to know you have these. You have a $1 million maximum for any one event. And there's lots of different things that are included under your accident benefits, such as rehabilitation or therapy. So please take a look at this so you have better knowledge of what's included in them. And last but not least, there is your travel coverage. So you have a $5 million lifetime maximum coverage in the event that you find yourself injured or sick when you are traveling out of province. There is a $120-day maximum for your trip duration, meaning that if you are traveling and you know that you'll be out of the province for longer than 120 days, you will need to make sure that you come back to the province before that 120 days hit, or you will not be covered. So you want to make sure that if you're traveling long, you plan a break in between to come back and make sure that you reset your coverage. It's very important to know that if you do find yourself traveling and you are sick or at a hospital, you will need to call the number on the back of your MoreCare travel card, which I will show you shortly. And we recommend that you call them immediately, maximum 24 hours after you've been injured or sick, to make sure that the insurance company is able to set up your insurance properly so you are not stuck in a different place of the world with a large medical bill. I just also want to make sure that you know that your travel coverage is only eligible for anywhere else other than Ontario or your home country. So if your home country is India, your travel coverage will not be eligible there. It will just be eligible anywhere else in the world other than Ontario or India. So that sums up all of your coverage and your maximums. Again, it's a lot of information, but it's always here for you in case you want to view more. So moving on, I want to make sure that I touch on this. On the left-hand side, you'll see a MoreCare Update COVID-19 Pandemic tab. If you click on that, it will take you to the MoreCare Insurance Facebook page, where you'll see there is a COVID-19 frequently asked question, where you can click on that, and it shows you all the most frequently asked questions regarding COVID-19, as well as anything regarding your benefit plan. Just please note that there are no changes to your benefit plan due to COVID-19. Going back, next you will see that there is a button that says booklets and forms. This will take you to the Your Space section. We like to say this page is going to be your best friend. There's lots of things here for you, and you'll find yourself on here quite a bit. So on the left-hand side here, you'll see booklets. This is where you can find your travel benefits card that I mentioned. On the back of it is the number you will call if you find yourself sick or injured. You want to make sure you print this or save this on your phone if you're traveling. As well as there is a travel benefit booklet. This is just a short little booklet that provides in-depth your coverage details for traveling. And then there's the 2021-2022 International Student Booklet. This is 64 pages of lots of information. So, we do recommend that you do glance through it, as it outlines, very detailed information. So that's there for you. On the right-hand side, you will see that we have forms. We have an instruction claim form, which will be very useful for you as it provides, steps on how to fill out each of the different types of claim forms. So, if you need any extra help, this is there for you. Continuing down, you'll see the 2021-2022 International Health Claim Form. So this is the form, and you'll need to, it's a fillable form, so you can fill it out all, on the computer. You would put your last name, your first name, make sure you put your detailed address in the event that, you need to be contacted. You'll scroll down and you'll see there's different sections. 1B is for dependents. So, if your claims has nothing to do with any of your dependents, that can be blank. Section 2 is very important. This has details about your claim. And then Section 3 and Section 4 would be if, paramedical would be if you were seeing a chiropractor, or Section 4 would be if you were going to a hospital. I know things are a little different now. People aren't able to be in person, where you would fill this out with the doctor. So if this section's blank, don't worry. But the third page is super important. You're going to want to make sure that you have to check off one of these two boxes here. If you paid out of pocket, so if you went to see a chiropractor and you paid and they've provided you a receipt, you will want to click the box that says payment is to be made to the student and include the proof of payment, which would be a receipt. Or if you were at a hospital or doctor and they provided you an invoice, you're going to want to make sure you click that box and provide all the original invoices that were provided to you. And after all that's filled out, you will email this claim to claims@morecare.ca, which you can see down here at the bottom. All right. Continuing on, you'll see there's also a dental claim form and your travel claim form, which are there for you if you see the dentist. And then scrolling down, you will see the student medical card. This is where you'll be able to print or save your MoreCare card. You put your birthday, your student number, click Get My Card, and you can print it, save it to your phone, and have this for you, when you're going to the dentist or whatnot. And then here's the discount network, which I mentioned when I was going through your dental coverage. This shows you a map of, pharmacists and dentists and vision clinics that can provide extra discounts for you. So as mentioned, if you do go to a dental clinic that you see on this map, you can get an additional 25% off. So if you have 80% coverage already, 25% off would give you 100% coverage, meaning you don't have to pay anything out of pocket. This map is catered to around George Brown's campuses, but if you are at home somewhere else, you can click Use My Current Location and it will show you anything nearby. Continuing, we have Provider Map. This Provider Map shows all the different hospitals and clinics that accept direct billing. This means that if you bring your MoreCare card and give it to them, they will be able to make you not have to pay out of pocket. We also offer some coupons. They're always changing, so keep an eye on these because who doesn't love some extra discounts. So we also have a 3-step process on how to submit your claims. If you're needing any extra guidance, this is also here for you. Continuing on, we have some great tutorials on how to submit a claim or just your plan overview, as well as a feedback section down here at the bottom. If there's anything that you found helpful or anything that thinks that's a little confusing, fill this out and we'll be able to look at it. I just want to make sure that everyone knows we have a wonderful call center. You can reach them by emailing help@morecare.ca or calling this number. They're open 7 a.m. till midnight and they're there to answer any questions regarding claims, plan information. So please don't hesitate to call or contact them. Down here at the bottom left corner, you'll see a button that says Live Chat. If you click that, that will bring up this screen where you can put your email in and it will pair you to a live representative within seconds who will be able to answer any questions you have. So that is your space section. And I just wanted to touch on 2 things on this page. In the bottom right-hand corner, you'll see a family opt-in and a choose plan. So your family opt-in's here for you if you wanted to opt your family into the plan. Family meaning spouses or dependents. So you will have 27 days to do so, and every single day this will go down. So you want to make sure if you're opting them in, you do so within 27 days. If you click it, you'll have to click that you're an international student. You'll have to pay a $735.87 fee. You'll go through all the terms and conditions. Then your family will be added in and they will have the exact same coverage that you have. Oops. Sorry about that. And then the choose plan, as I mentioned earlier, if you went through all the coverage and you decided that you wanted to opt into the enhanced dental plan, you can click the choose plan again within the 70 or 27 days. You'll put your program, you'll put your student number, and then you can pick which plan that works best for you. All right, so that is everything important on that page, and I can bring you back to this page where there's a couple of little things I wanted to touch on before we open it up for questions. So we do offer students to be able to submit their claims online. So if you click this button here that says how to submit your claims online, it will bring you to this wonderful infographic, which step-by-step shows you how to register, as well as outlines which claims you can submit online. So, all your OHIP alternative claims, travel, and accident claims will have to be submitted by mail only. You cannot do that online. But your drug, dental, and extended health claims, you can submit online. So if you go see a massage therapist and you wanted to submit that, you can do that online. To submit them online, you'll go just to the left and click e-profile for online claim submissions. You'll click that tab. It will bring you here where you can click register. You'll go through all the different prompts. It will ask you to make a profile, add your direct deposit. And then once you have created that, you can sign in and then you're good to go and you can submit your claims online. Moving down, I just wanted to touch on our call center's number again. If you're having a tough time booking a doctor's appointment, or you just don't know where to start and you want some extra guidance, please call our call center. They are super helpful and they will help you with anything that you may need. Please just note that if you see the family opt-in and choose your plan and opt-out on this page, this homepage does share it with the domestic students. So if you are opting your family in, you want to make sure that you're doing so from your international page from clicking that orange tab and on the bottom right-hand corner. The final couple things you'll see here on the top right corner, a red tab that says virtual doctors. If you click that, it will bring you to Maple. This is a virtual doctor's kind of system where you are able to create an account and talk to a doctor from the comfort of your own home. If you have a sore throat, if you're not feeling well, you can do it all virtually, so you don't have to go to a doctor's or to the hospital. So it's always a good place to start here. Finally, I just wanted to let you all know that there is a language option where you are able to change the languages if you are, if you're wanting to read it in a different language, that option is here for you as well. So that pretty much includes all of the website. We went over your coverage, how to submit claims online, and how to reach our call center if you do need any extra assistance. So I'm gonna stop sharing my screen and Kim and I will be here to answer any questions that you have.
Awesome. Thanks, Elizabeth. That was great. I did just want to, continue to just, what should I say, highlight the virtual doctors tab that was touched on at the end. I really want to make sure everyone understands there's no additional cost associated to that. That is all direct billed on your plan. So there is no out-of-pocket expenses. I highly recommend using the virtual doctor as your number one step. The Ontario, just the way that the health works in Ontario is different than other countries. So I highly recommend going to the virtual doctor first so that you can actually speak to a doctor and see if you actually need to see someone in person or not. It's going to save you a lot of time and it's going to save you out-of-pocket expenses. So thank you for pointing that out. All right, there's a couple questions and Elizabeth and I will quickly go through them. Someone was asking if you have to pay extra for any of the different plans. And no, so if you're looking to change your plan, so the flex plans, you can change at no additional cost. What you will notice is if you're choosing an enhanced dental plan, for example, you'll have more money in your dental, but maybe less coverage elsewhere. So it all kind of balances out in the end, but there's no additional costs required if you are looking for that. There are some kind words. That's great. Great presentation, Elizabeth. So there's a question about COVID-19 treatment. So Elizabeth did mention that there is the frequently asked questions page, which you can find on the MoreCare website or just simply our Facebook page. But there are no exclusions to COVID-19 under your plan. The only thing that you will need to pay out of pocket is any tests required for travel or work purposes. If you have symptoms, your COVID-19 test will be covered. Any, tests that you have to pay for travel, for example, if you have to come to Canada, you need to pay for those out of pocket, just like any other Canadian or Ontario, resident would need to. So that's pretty much the only exception there, or exclusion, if you will. But COVID-19 is treated just like any other illness. If you do get hospitalized, it would be covered. This is being recorded and it will be sent to the SA, so you can reach out to them to see where the recording will go. Also, someone said, can we use the OHIP alternative to register for the booster shot for COVID-19? Good question. You actually don't need to. So when you go through, that's a government website. So this is just from my own personal experience of going through it. So I do not work for the government. I want to make that clear. But when you go through the government website, it will say, do you have a green health card? Do you have a red and white health card? Or do you have no health card? And you do not have a health card because they're asking about an Ontario health card. This MoreCare insurance is an insurance plan that you have as a George Brown student, but it would not be required for the vaccine, as that is all covered by the Ontario government at this time. Okay, so just when you're going through for the booster shots, just click that you don't have health insurance, because you do not have provincial health insurance. But you do have your own health insurance plan. It's just different than what they're asking for. I know it can be confusing though. Someone said that my family will arrive in Canada in March after the deadline to include the family. How do I do that? Is it possible to include family at another time? Great question. You are able to opt in your family within 30 days of a life change. And your family arriving in Canada would absolutely suffice as a life change. So you would simply have to go to the SA and they will let you know next steps for opting in your family outside of the typical time period. So I do see a very, very long personal message that because this is a public forum and it is being recorded, I'm not going to be answering any personal health related questions. But I do see that the main issue here was that they were saying that they're not active. And it is possible that we simply have not received your name on an enrollment file yet. That is not to say that you do not have coverage. It is simply to say that we are still receiving enrollment files from George Brown. And we are still uploading students to it. So if you do urgently need to see a doctor, you can reach out to the SA to make sure that they have sent your name on the enrollment file. But you are covered as of January 1st. It just, the first week we're still receiving, files and that sometimes can take a couple of days. So if you urgently need to see someone and you do not want to pay out of pocket, reach out to the SA to make sure your name was included on their enrollment file. So also, if you were to opt in your family, you would be opting them in from January 1st, 2022 to August 31st, 2022. So someone asked if you have a prescription, how can I get that in Toronto? So if you have a prescription from your home country, you absolutely will be able to get that here. You simply will need to see a doctor. The virtual doctor's option is a great option, and you'll have to let them know that you have, prescription XYZ from your home country, and you are looking to have the Ontario equivalent. So simply let them know that. They'll be able to give that to you, and then you can go to a pharmacy to get that filled here. And thank you, Yukiko. You can reach out to health benefits at SAGBC.ca if you would like to reach out to George Brown directly. SA means a student association. That is what the SA means. Good question. And then someone said, are we going to have a health card? So Elizabeth did show you where you can get your MoreCare card. That is the equivalent of a health card. We will not be sending any physical cards, but you absolutely can. And I would recommend printing out that card, keeping it in your wallet, keeping it in your pockets. You can download the MoreCare app as well, and you can have your insurance there. But your insurance card is not the same as the Ontario Health Insurance Plan. It's important to know that the OHIP alternative is an alternative that George Brown and MoreCare have created for you. It is not the Ontario Health Insurance Plan. It is an alternative. Yeah, if you want to get the discount at the pharmacy, you just have to go to that specific pharmacy, let them know that you're a We Speak student, MoreCare student, and they'll be able to put that discount through for you. Someone said, have we paid health insurance for 2 years or do we have to pay again? So you pay each policy year, which is each school year. So right now we're in the 2021-2022 school year and policy year. And then moving forward, we will be in the 2022-2023 policy year and school year. So it will start again September 1st. Through your new tuition payments in September, you will also pay for your health insurance. Wonderful. Okay, so I'm just going to write a couple things here at the bottom. So this was just a reminder. This is the Student Association at George Brown College email. This is our email, morecare.ca. Oh, sorry, that is our website, I should say. That is our website. So please head to morecare.ca if you would like to reach out to us by email. You can say help@morecare.ca. And finally, please do, I highly recommend downloading the MoreCare app. You simply have to type in MoreCare Insurance into the App Store and it will come up. It's a lovely blue icon. I always awkwardly, I should just have a picture of it on my screen that I share with you, but instead I will awkwardly show you my phone with what the MoreCare app looks like. So it's that lovely right there. There we go. There we go. Makeshift. So that is the MoreCare app. And I highly recommend following us on Instagram because if we were in person, I would ideally have some fun free things to give you, some fun free swag. But sadly, we're not in person. So we're going to be doing lots of fun giveaways in addition to providing lots of information. So please go follow at MoreCare Insurance on Instagram for lots of updates too and lots of fun things. Last but not least, I see one final question. If I have my MoreCare card, can I go to a hospital anytime or I have to contact you first? You absolutely do not have to contact us first. Even if you don't have your MoreCare card, please still go to a hospital. If you have to go to a hospital, please, please, please go. If you are not wanting to pay out of pocket or you're concerned about paying out of pocket, you can absolutely call us on your way while you're there and we can help you. But please do go to a hospital if you need to. You know, your health is number one importance, and we don't want you to wait if you need to go. You know, someone asked if their partner has a working permit, he needs to opt into my plan or he should join OHIP. That's an entirely personal choice. I can't really tell you what you should and should not do, but if your partner does have the option to go on to the Ontario Health Insurance Plan, I think that's a great option. But again, I think that's something that he needs or they need to decide for themselves. Okay. So the recording will be sent to GBCSA. You can send them an email if you're wondering where to get the recording. Unfortunately, I'm not sure exactly where the recording will be, but I imagine it will be somewhere on the website, but reach out to the Student Association and they'll let you know where to find the recording. Well, Elizabeth, thank you so much for going through everything today. I think it's safe to say you went through everything very well, that there were not many questions. So that's great. And thank you, everyone. And thank you, Yukiko. There's something that's going on today at 2:30. So feel free to hop on that link right now. Okay, thanks everybody. Happy New Year, happy Friday, and have a great weekend.
Bye, thank you.